Have you ever heard someone tell a woman after she gave birth, "Oh, well, it's just the baby blues," or "Of course you're gonna cry for a while. I mean, you just gave birth. How about you'll feel better, just give it time." Statements like these have led to many myths about postpartum depression, a serious mental illness followed by the birth of a baby that is caused by an abrupt decline in estrogen and progesterone levels affecting one's physical and behavioral health. Affecting up to 1 in 7 women, let's debunk some of the most common myths regarding this illness. This is debunking postpartum depression. Myth number 1. Postpartum depression always occurs in the first few months following childbirth. This is false. The truth is, postpartum depression can occur anytime within and after the first year of giving birth, with varying periods. Most women experience postpartum depression within the first 3 to 4 months. Common symptoms, such as mood swings, are expected within the first couple of weeks after birth, but women may experience a progression in symptoms after multiple weeks. One study conducted showcased that 63% of women involved with the experiment reported symptoms of depression within 9 months after giving birth. Of the 63%, most people reported that the symptoms continued to last until 12 to 16 months after childbirth. Subsequently, postpartum depression can also affect people after the first year of childbirth. One study has shown that around 9% of mothers experience late onset postpartum. That is, postpartum depression that occurs after the first year, after 2 years of giving birth. Myth number 2. Postpartum depression means women do not love their babies and may harm them. Wrong. It's a frequent misconception that postpartum depression is associated with the fear that mothers may hurt or kill their baby. This is because postpartum depression is often confused for postpartum psychosis, two very different things. Postpartum depression is a non-psychotic depressive episode, whereas postpartum psychosis is a manic psychotic episode that is temporarily connected to childbirth. Postpartum psychosis is rare and does not occur frequently, affecting 1 in every 500 women. Also, a mother's postpartum depression does not imply that she does not love her baby. There are chemical imbalances and hormonal changes associated with postpartum depression, which can have an impact on the mother's capacity to bond and attach to her baby. But the mother's depression at the time is unrelated to her lack of affection for her child, because these chemical and hormonal changes are not in her control. Myth number 3. Postpartum depression is just the baby blues. This is false. There is a very distinct difference between baby blues and postpartum depression. Baby blues typically occurs around 2 days after a mother gives birth to her child and encompasses a variety of symptoms including mood swings, decreased appetite, anxiousness, and irritability. These occur as a result of multiple factors that occur after birth, such as substantial hormonal changes and lack of sleep. Despite all these symptoms, baby blues tends to resolve within 2 weeks of onset. On the contrary, postpartum depression is a condition with more extreme effects than that of baby blues, meaning the symptom of crying is also more excessive in individuals with postpartum depression. Postpartum depression also has a tendency to progress and worsen over the same 2-week period. Thus, it's just the baby blues may not be the most accurate thing to say to a mother with postpartum depression. Myth number 4. Postpartum depression will go away on its own. Again, this is wrong. Postpartum depression symptoms can start within the first 3 to 6 months of having a child, but can last indefinitely. While the symptoms may go away within the same time frame, some other mothers experience these symptoms indefinitely. This is dependent on many factors, such as the individual's support system, access to therapy, history of mental illness, and more. Studies have found that almost around 38% of women experience chronic symptoms of postpartum depression and end up developing ongoing depression. 30% of women who did not receive any clinical intervention for this depression experience symptoms up to 3 years. This means people experience postpartum depression for an indefinite amount of time, and the symptoms of this illness will not simply disappear unless some form of medical or clinical intervention is involved. As we have seen, myths about postpartum depression may be related to specific symptoms, its presence in society, and treatment options. It is important to debunk these myths because myths cause stigma, and stigma discourages women from seeking professional help. If you or someone you know is going through postpartum depression, the following are just some resources that are here for your aid. The Women's Health Concerns Clinic at St. Joseph's Healthcare in Hamilton, Ontario, the Postpartum International Support, and Healthy Babies, Healthy Children program. Now it's your turn. Let us know in the comments below other postpartum myths you've come across. Thanks for watching.